Okay, Felicity, let's start with an overview of the COVID situation in the Asia Pacific. How many cases are we seeing there at the moment?
Yeah, so already we've seen over 150,000 cases in Asia Pacific. Over half of those, 84,000, have been in China. However, nearly every country in the region, with a few exceptions, have seen some cases, and the highest burdens are currently in Indonesia, the Philippines, Malaysia, and Thailand. From those cases, we've seen just over 6,700 deaths in the region. But I think it's important to note that the necessary mitigation measures across all countries have interrupted public life and slowed economic activity, and that's affecting the livelihoods of the 2.2 billion people who live in the region.
So why is this region in particular a focus for UNICEF Australia?
Yeah, so over the past months, since the beginning of the year, we've seen the absolute havoc that COVID-19 has caused in wealthy countries, and how once the outbreak occurred, comparatively well-equipped health systems have become overwhelmed in trying to contain and treat the disease. So having spent a lot of time in the Asia Pacific region, and particularly in the poorer countries in this region, we're very concerned about the dire situation that would ensue for those countries with weak health systems that struggle to provide treatment and access to essential medicines just under normal conditions. And so it's the need to assist these countries to protect their citizens and to help them to be prepared in case of an outbreak. That's something we feel really needs to be prioritised. If we're going to avoid seeing this kind of health emergency quickly turn into a catastrophic humanitarian crisis for children. For UNICEF Australia, this isn't something new for us. We've had a strong focus on the Asia Pacific for quite a few years now. We support a large number of development programs and have established strong partnerships with UNICEF country offices in the region. So our focus on the region is also about solidarity with our near neighbours and focusing where we know that we can make a difference with donations from the Australian public.
So tell us now some of the specific details. What are the specific challenges in responding to COVID in these countries, particularly ones that maybe people might not have anticipated, that, the people here listening, like myself, might not have realised that that would actually be a factor?
Yeah, sure. Look, the most immediate need is to enhance the preventative and preparedness measures to help countries mitigate and respond to the virus. So first and foremost, this is about a public health response to reduce transmission and ultimately reduce the number of deaths that we would see in the region. And for this to occur, there's kind of two main areas of concern. So firstly is ensuring that children and caregivers and the general population receive targeted and accurate information on the virus and how they can protect themselves. So clear messaging about the virus, how it spreads, what the symptoms are, and the importance of things like hand washing and social distancing. And so there is a challenge in getting those messages to remote communities and making sure we all have the tools to be able to protect ourselves and our families. Secondly, it's about the health system and ensuring that health facilities have the necessary equipment to treat the patients, to protect the health of healthcare workers who are responding, and ensuring that there's facilities for hand washing. So to highlight that issue, in Timor, 70% of health centres don't have running water or the facilities for hand washing. And so we know that hand washing is critical in the prevention of the spread of this virus. So part of the response and the challenge is really how do we ensure that those facilities exist, that health centres, that schools, early childhood centres, nutrition centres have soap. They have ways that they can implement that. The other side of the coin is the socioeconomic impacts, particularly for children as a result of the virus and the mitigation measures that have been put in place. Firstly, what we're seeing is that this is causing a global recession. When we're talking about a global recession, we're really talking about income. And at a household level, incomes fall, that has really grave consequences for households who already have very little income and few assets to draw on. There's some sobering data starting to emerge from poor countries like Bangladesh, where they're doing some real-time monitoring of these things, where people are the day labourers, they're on unstable wages, that due to the lockdowns, these families essentially have no money at all. And this obviously then has a consequence on nutrition, it has a consequence on healthcare and what those households can basically purchase for themselves or ways that they can assist themselves. And the longer that this goes on, the more that we will see families selling off productive assets that then will have even longer term consequences on how they can resume income generating activities after the kind of immediate response is finished. The other area we're very concerned about is education. So schools have been preventatively closed across nearly all countries, and never in history has there been a time when so many children are having their education disrupted. Globally, 1.5 billion children are currently not in school. In Asia Pacific, this is about 325 million children. You know, nothing like this has ever happened in modern day times, but the effect on children and its learning is really hard to fathom, because it's hard to appreciate what it's like when we're here in Australia and our own children are doing remote education, what it's like in countries where they don't have access to internet, they don't, you know, many times have access to TV or a radio. So we're having to go back to old school things like sending out workbooks and pencils for children to be able to continue that learning. And part of that concern is that we know from the evidence from previous emergencies that where kids are out of school for prolonged periods of time, we see increasing kind of dropout rates when school resumes of those children. If they fall behind, if their learning is disrupted, if there's not some way to continue engagement, then we are really concerned about what that means for the futures of many children who might not return to school. Two other things that we are concerned about is kind of ongoing health and nutrition, the continuity of those health services. We know that as attention shifts to COVID, there's still going to be babies being born. There's still kids that need to be immunised. There's still going to be issues around nutrition, particularly, as I said, with incomes falling and the need to be screening children for you know, severe acute malnutrition, moderate acute malnutrition, and being able to respond to those. And that means keeping health centres open. It means helping health workers know how to protect themselves so that they can continue those services. But we are seeing, and we are having reports of places such as Timor, where because of fear of the spread of disease, particularly, you know, I've just mentioned that health centres don't have running water and the means for hand washing, that those health centres are closing or services are restricted. So we're seeing an increase in women giving birth at home. And that increases, you know, all kinds of risks and things that we've been working on in development programs for a long time. That is also part of the challenge. So it's not just the direct kind of health issues, but all the other issues for children. The last area, and this is one that we're just starting to really talk about in Australia, is around child protection, around instances of violence, particularly domestic violence, and also mental health. So 60% of children globally are living in countries where there's some kind of lockdown. And for children who live with the threat of violence and abuse at home, this is truly terrifying. Children often rely on schools as places that are safe for them, or places where they report violence. So those school closures are having flow-on impacts. We also know that stresses that are associated with isolation and the economic impacts that families are feeling will exacerbate levels of violence. So child protection services also need to be part of what we're supporting in terms of the response.
Well, it sounds like it's a pretty dire situation from what you've said, both in the immediate, the short term, things like not having soap and running water to wash hands, but also in the long term, hearing that there are 325 million children out of education in the region is a staggering figure, which has to have long-term impact. What is UNICEF's Asia Pacific Children's Response Fund?
So UNICEF Australia has essentially set up this fund for our donors to be able to directly support programming for children and young people in Australia and in select countries that are close to home. We know that it's important for our donors to know where their funds are going and for us to be able to give confidence that those funds are going to be used effectively, and for us to provide information back to donors on how the funds that they've donated are being used.
How much does UNICEF need to be able to properly assist the region through the crisis?
Okay, so at a high level, at a high level, the appeal for East Asia Pacific region for UNICEF, you know, as a whole, they're appealing for $68 million for the region. That's the whole response, and we're currently at about 50% of that, which is funded. So there's still a massive gap in that funding. For UNICEF Australia, however, and our support for the region, we're targeting a contribution of $3 million, 3 million Aussie dollars. So we feel like that's achievable. Like, we feel we have the kinds of donors on board who are wanting to support that. And $3 million does sound like a big amount, but we know that every little bit counts, and there are things that we can be doing that will have a huge impact for children, no matter what the donation is. If it's a small donation but it combines with many other small donations, that can actually go really far. And maybe to give a sense of what that money can do in the region, I'll just give a couple of examples. So in Timor, a donation of $50,000 could reach 3,000 people with hand washing facilities and supplies. In the Pacific, among the Pacific Island countries, 160,000 could reach 46,000 people with risk communication messages. And as I said, tackling those you know, myths and misinformation that are circulating. In Papua New Guinea, a country very dear to my heart that, you know, I've visited many times, and I have, you know, grave concerns for it. Really, once you leave Moresby, is a country that has dire issues. But, you know, 240,000 Australian dollars would provide essential nutrition supplies for pregnant women and children for 53,000 pregnant women and 116,000 children. You know, this is a country with 50% stunting. So we see that as a really important contribution.
All right, well, I think we should switch over now to the questions from the audience. Thanks for the great presentation. Do you think COVID-19 will affect girls and boys differently in the region?
Yes, definitely. We know that there are gender dimensions in every aspect of our work, but particularly in COVID, it will particularly impact girls on the front of gender-based violence. It will impact girls in countries where they're already disadvantaged in terms of access to healthcare and nutrition and things like that. I think that there's real risks for girls in terms of, you know, access to wash facilities. We have particular needs, and they're really heightened at a time like this.
Next question says, how is Vanuatu coping post-Cyclone Harold while dealing with the virus restrictions? Is UNICEF still responding to other emergencies like these? Because, of course, unfortunately, the other emergencies haven't stopped just because COVID's here.
Yeah, Cyclone Harold has obviously added to the complexity of responding to COVID, and COVID has added to the complexity of responding to emergencies such as Cyclone Harold. UNICEF is responding. The government in Vanuatu relaxed some of the social distancing regulations to allow people in Vanuatu to go to evacuation centres. We did provide supplies. One of the issues was that supplies had to go through quarantine before they could get to the affected areas. There's areas where the roads have been destroyed, where it's very difficult to get supplies to those areas, and UNICEF is, delivering supplies by boat in some of the islands. So we are still responding amidst the complexity, but COVID-19 has certainly added to that, the issues in both getting supplies to Vanuatu and the distribution of those supplies.
Next question asks, can you talk about the role of supply division in global response, e.g. Africa? So I think what they're asking is, talk about how UNICEF decides what goes where.
Okay, so the supply division obviously has agreements with suppliers around the world. They do have large amounts of supplies in the warehousing in Copenhagen, but they also pre-position supplies around the world. So in many countries, or many regional hubs, there will be supplies. UNICEF had supplies in a warehouse in Brisbane here that were deployed, I think last week or the week before, to the Pacific with the assistance of the Australian government to transport those supplies. There will be supplies present already in Africa, in places like the Philippines. They negotiate on kind of costs of essential supplies. They develop, they do R&D on what should be in those supplies. So what's needed in a hygiene kit, what's needed in a recreation kit for early childhood age group, what goes into a school in a box for schools, the development of tents. And they do quite a lot of research and development onto what works and what's going to be effective. They then obviously deploy those out. And there has been a global shortage of, personal protective equipment, for example, a shortage on things like ventilators and getting those to where they're most needed. But we are starting to see that getting resolved. I mean, Timor had huge issues with accessing supplies because they didn't have any local supply that they could access. But we know that now they have about 80% of those supplies that they've secured.
And last question is, if I make a contribution to your work in a specific area, how can I be sure that my money is going to the project or the country that I care about?
Yeah, so UNICEF has globally a fantastic financial management system, and when a donor gives to UNICEF Australia, that donation is coded according to how that donation needs to be earmarked. And so when we remit funds, we might be combining your donation with other donations, but we can really specify this is what it's for. So for example, if you're wanting to give to COVID-19, but you want that to be for the Asia Pacific Children's Response Fund, for example, you can go to our website and give through that kind of appeal page, and that will then code your donation to be for that specific response. And we will ensure that that coding then carries through when we remit those funds. If you specifically want your donation to go to Papua New Guinea, for example, you can also arrange with your contact at UNICEF Australia that's where your interest lies and where you care about, and you can earmark your contribution for that. And obviously we'll then report back on our response in Papua New Guinea if that's where your funds have been sent.
Well, that has been absolutely fascinating, Felicity. You certainly have a big job ahead of you, but hopefully we can all help a little bit with that. And if you would like to be part of UNICEF Australia's vital work in the Asia Pacific and help them to achieve so much of the great work that they've already done and are aiming to do into the future, you can either click on the link that is going to be put in the chat, which is just unicef.org.au/coronavirus-appeal. So that link will be put in the chat for you, or you can just speak directly with your UNICEF contact. They will be very happy to assist you. And if you have got any burning questions that we didn't get to, please feel free to speak to your UNICEF contact about them. They'll be very happy to answer. And a huge thank you to all of you for joining us today and for your support and for your interest in UNICEF Australia, and for the great questions as well. Felicity, thank you. I have certainly learned a lot. I really appreciate your time. And to everybody else, enjoy the rest of your day.